Do you often feel sudden headaches that are so strong they wake you up at night? Or maybe your scalp hurts when you brush your hair. If yes, you might be experiencing signs that something deeper is going on. Imagine your body's highways, the arteries getting inflamed and swollen. That's what happens in giant cell arteritis, GCA, also known as temporal arteritis. It mainly affects older adults, especially over 50, and often hits the arteries near the temples. Think of it like a garden hose that's been squeezed, less blood flows through, and the area beyond suffers. One scary part, it can threaten your vision, but catching it early can save your sight. Sounds serious? It is. But don't worry, once we understand it, we can fight it. What causes arteries to get inflamed like this? Well, think of your immune system as a security guard. Normally, it protects you from germs. But in GCA, the guard gets confused and attacks your own arteries, especially the ones in your head. Scientists don't know exactly why this happens, but age, genetics, and even geography play a role. For example, it's more common in northern countries like Sweden or the UK. If your mom or dad had it, your risk goes up. It's like inheriting a slightly faulty alarm system. Recent studies also suggest that certain viruses might trigger this mistaken attack, but that's still being studied. So, it's not caused by something you ate or stress. It's more about your body's defense system going off track. Now, how do you know if it's giant cell arteritis and not just a bad headache? Let's play detective. Do you have a headache every day, focused on one or both sides of your forehead? Does your temple look swollen or feel tender when you touch it? What about sudden jaw pain when you chew, like your jaw gets tired after a few bites? That's a big clue. Some people wake up with blurry vision or even sudden vision loss in one eye. That's an emergency. Other signs, feeling tired all the time, dropping weight without trying, or having fevers for no clear reason. Imagine you're at dinner eating a steak, and your jaw aches so much you have to stop. That's not normal. That's your body shouting for help. How do doctors find out if it's giant cell arteritis? First, they will ask about your symptoms and check your temples. Then comes a blood test like ESR or CRP that shows if there is inflammation in your body. Think of it as a fire alarm. But the real proof, a temporal artery biopsy. It sounds scary, but it's a small procedure. They take a tiny piece of the artery from your temple and look at it under a microscope. If they see giant cells, hence the name and swelling, bingo, it's giant cell arteritis. Treatment starts fast usually with a steroid called prednisone. Imagine turning off the fire before it burns the whole house. Most people start feeling better in days. But treatment can last 1 to 2 years and doses are slowly reduced. Quick action can save your eyesight, so don't wait if you have symptoms. Can you prevent GCA? Right now, there's no sure way to stop it before it starts, like trying to stop a thunderstorm with an umbrella. But early action is your real shield. If you're over 50 and get new, strange headaches or vision changes, don't brush them off. Tell your doctor right away. Regular checkups matter, especially if you have long-term fatigue or unexplained fevers. Knowing your family history helps too. If your aunt had GCA, mention it. Think of it like weather alerts. You can't stop the storm, but you can prepare. Living well, eating right, staying active, keeps your body strong, even if it can't block GCA directly. Science is moving fast. Imagine a new blood test that doesn't just show inflammation, but pinpoints GCA with 90% accuracy. Researchers are working on it. New drugs like tocilizumab, an injection, are already being used alongside steroids to reduce side effects and keep relapses low. It's like having a second firefighter on the scene. Experts are also using ultrasound to see inflamed arteries without surgery, like using a camera to look inside the walls of your house. And AI is being tested to help doctors spot GCA earlier by analyzing symptom patterns. These tools could mean faster treatment and fewer biopsies in the future. So while GCA is tough, the future is looking brighter.